You're listening to the Public Health Perspectives podcast. Welcome to another episode of Public Health Perspectives, a podcast series targeted towards strengthening the future public health workforce. We will explore the narratives of public health care professionals and gain insight on career paths that shape the profession. And now, your host, Camilla Singletary.
Welcome to another episode of Public Health Perspectives. Today I have Montrece Ransom on the show with me. Ms. Ransom currently serves as a team lead for training and workforce development with the Public Health Law Program and the Office for State, Tribal, Local, and Territorial Support at the CDC. Welcome, Ms. Ransom.
Thank you for having me.
And just to start, I like to always ask people a bit about their background and especially about their educational background. Could you give me some information on that?
Absolutely. So I have a law degree that I got from the University of Alabama in 2001. I earned my master's in public health from Emory's Rollins School of Public Health in 2009. I also have an undergraduate degree in speech communications, which I earned from Columbus State University, and I won't say the year that I earned that.
What made you become interested in pursuing a law degree?
It's one of those things where, when you're little and there are career paths that you are exposed to, and you kind of pick one. And so law was one of those career paths that I was exposed to when I was about 7 or 8 years old, and I started telling folks when I grew up I'm going to be a lawyer. I was pretty talkative and kind of argumentative as a youth, so that was not surprising to people, and that sort of just stuck with me. And then when I was in law school, I focused on employment law, thinking that I would do something in the realm of sex discrimination or employment discrimination, something in that area. But I quickly realized that I wasn't interested in a traditional legal career, and I started committing to doing something in public service in some capacity. And then a friend of mine introduced me to the Presidential Management Fellowship Program, and that kind of led the path for me to start a career in public health law.
So can you talk about the connection between public health and law?
Absolutely. It's one of my favorite things to talk about. And I really say it in one simple sentence. There is no public health in this country, at least no governmental public health in this country, without the law. Whether it's a clean indoor air ordinance to reduce smoking rates, or it's using the law to create a health department, which is done by statute. It really is the law that helps create the framework for public health practice in this country, and it also is the law that helps make our default choices healthier. And honestly, I can't think of one public health problem or one public health challenge that can't be solved without some contribution of public health law or policy. Once we understand the science, which is clearly important, and we have an evidence base for action, it takes the strategic power of the law, or as I like to say, the legal might, coupled with the scientific insight that really moves us toward lasting changes in health outcomes. And so that, in its basics, is the connection. But there's so many ways that you can explore the role of law in advancing public health. Depending on what the new and emerging issue or disease is, there's always some role of law in advancing that topic. And sometimes we don't even really think about the impact of those laws. One of the things that we're exploring in our program is this idea that law itself is a social determinant of health. How we set up our legal structures and how we enforce and implement laws can certainly impact population health. And as we think about things like transportation, education, housing, they are all issues at the heart of the stuff we work on in public health, and there are legal structures that set those up as well. And so there's definitely a connection.
Perfect. Give me some insight on your career path and then, of course, your current role with the CDC.
I started at CDC in 2001 as a Presidential Management Fellow. I was appointed in June of 2001, and my first appointment was with the Financial Management Office. And I worked on the congressional and legislative team, where my primary responsibility was really planning visits for members of Congress and their staff to CDC. After 9/11, I was asked to serve as an operations analyst in the Emergency Operations Center here at CDC. It was there that I was introduced to a man named Dr. Tony Moulton, who was serving as the first director of the Public Health Law Program. And he asked me to join his team on what we call a rotation. As a Presidential Management Fellow, I was required to do 2 rotations throughout the federal government to give me an opportunity to be exposed to federal government operations and management across the board. But I decided to do my first rotation at CDC's Public Health Law Program. It was supposed to be 3 months, and it really kind of turned into the rest of my career. My first 3 months there, I planned the first national conference on public health law, which is someone with a law degree in a scientific agency who's not working in the Office of General Counsel. It was kind of hard for me to really understand early in my career, what was I doing here with all these scientists?
Right.
But planning that conference kind of really made it clear to me, again, there is no public health without the law. I planned 28 concurrent sessions on everything from asthma to water and the law. And so I quickly began to realize that there's a role for those of us who are trained in law in this field of public health. So I worked in the public health law program that first stint for 2 years. Most of what I did was conference planning and programming for folks in the field, our state, tribal, local, and territorial public health practitioners. But, it was really integral to my career because that was really when the public health law program was just getting started. So I was able to be involved in shaping the beginnings of what that program looked like, and I had the opportunity to create something called the Community Public Health Legal Preparedness Initiative, which really focused on public health emergency preparedness for communities, but was an opportunity to bring public health lawyers together with healthcare lawyers, or lawyers that represented more traditional health system partners, hospitals, and providers. And we did trainings, we did a bunch of educational programming, continuing legal education credit that really exposed lawyers to this field of public health law and really encouraged health lawyers to begin to see their field as a little broader than traditional health law type of work. That work led to the creation of sort of a first of its kind, a unique partnership, a non-traditional partnership between CDC and the American Bar Association's Health Law Section and the American Health Lawyers Association. And those experiences kind of helped solidify my role here at CDC, that there was definitely a place for someone who was trained in law to help advance the field outside of the Office of General Counsel. And so in 2009, I earned a master's degree in public health, and then I spent 2 years following that working on what we call the National Conversation on Public Health and Chemical Exposures, and I worked in the National Center for Environmental Health at CDC. I did that for 2 years, and during that time, we had a wide variety of folks that participated in that project, but I helped two major work groups, the Chemical Exposures Work Group, or Chemical Emergencies Work Group, and the Policies and Practices Work Group, and we created an action agenda on chemical exposures. Literally right around the time that project ended in 2011, I got a phone call from Matthew Penn. Matthew Penn had been staff attorney for the South Carolina Department of Health and Environmental Control, and he'd been a really good friend of mine. As someone working on the federal level doing public health law, I really needed a mentor or someone in the field that I could go to really talk through the issues that we were providing guidance on, and Matthew became that person for me. And so he would be my sounding board. Does this make sense from a state perspective? Does this approach resonate with you in the field? And so we'd worked together for a decade prior to getting this phone call. He called me up and he told me that he'd gotten the job to become the director of the new public health law program, or the revised public health law program. And he asked me if I wanted to come back. And I said yes, but only if I get to do training in workforce development. And he said, what's that? And I said, I don't know, but if you give me some time to build it, we'll figure it out. And so for the last 7 or so years, that's what we've been doing. We've been really working to advance the understanding of law as a public health tool. We train an average of 10 to 12,000 people on my team every year on a wide variety of public health topics. Most recently, we've launched, with our partners Change Lab Solutions, we've launched the Public Health Law Academy, which is an online, on-demand training resource for folks in the field that has been really, really well received. And so I've kind of carved a role for myself as an expert in public health law training, and I tell people all the time that I've really hit that sweet spot in my career. It combines my undergrad degree in communications with a focus on training and development with my law degree and my master's in public health, and it gives me an opportunity to work with students and people that are just starting their careers. And so I've really hit the sweet spot.
And I was thinking about, when we had our initial call, I was thinking about, you kind of asked me where I wanted to be, or, kind of thriving where you are, even if it's not necessarily where you think you should be right now.
There are a couple of sort of mantras that I have. The first one is bloom where you were planted. Sometimes the universe will put you in a place and you're wondering, how on earth did I get here? And honestly, I did ask myself early on in my career, as someone who had no interest in science at all, and going to law school because, I told people that's what I was going to do, and people held me accountable for that. And then I end up in this agency full of scientists. And then I begin to realize that sometimes it's substance over form. If you can find the way to build the skills you want to build and get those sort of touch points. I'm a talker. My undergrad degree, again, is in speech communications, and I like to train. I like to be on stage. I did not know that CDC was going to give me those opportunities, but if I didn't learn the business of CDC, if I wasn't open to getting that MPH and learning more about what public health was and trying to figure out what my role was and really blooming where I was planted, I wouldn't have hit this sweet spot. There certainly were some times along the road where I was like, what am I doing here? I need to find something else to do, find another agency to work for, or find a whole different field or industry to go in. But somehow along the way, the universe and my mentors really just kept encouraging me and reminded me that this field of public health is so broad that there's room for all of us at the table, and that there are a cadre of people who are similar to me in personality, similar to me in background and in expertise, that are coming up through this field who need to see someone who looks like me and with my personality in this field to know that there is room for them.
Exactly.
And so I'm a big, firm believer in blooming where you're planted. If the research is giving you what you need and that role is giving you what you need, it may not be the form that you thought you wanted, but if you're getting the substance and you can check those boxes, then it might be just what you need to get you to the next level. And oftentimes we don't even know what the next level is until we sit still for a minute and get comfortable and become knowledgeable where we're sitting right now.
Definitely. You mentioned the Public Health Law Academy. Who are the trainings offered to? So is it just like working public health professionals, or are there opportunities for students to be a part of the Public Health Law Academy?
Absolutely. We created the Public Health Law Academy knowing that there are people who are interested and certainly need to learn about the role of law in advancing public health, but don't have access to someone who can deliver a training course to them in person, or maybe didn't have access to a public health law course in their undergraduate or master's level courses. Those are really beginning to become much more popular now. But we know that understanding and analyzing the connection between law and health outcomes is one of the huge knowledge gaps in the field of public health right now. So we wanted to create a place where people could go to get online, on-demand training in a wide variety of topics in public health and the law. So the website is publichealthlawacademy.org. The audience that we targeted in creating the trainings are absolutely everybody. Primarily, I would say entry-level to mid-tier public health practitioners, folks that are working in state, tribal, local, and territorial health departments, but also their partners across the health system. I know a lot of our academic partners, faculty that are teaching courses that don't necessarily have a legal nexus, but where they want to bring one in. They're using some of the academy tools for that. And students who want to learn more about public health law generally have been accessing our trainings. I don't have our numbers in front of me, but we launched our academy officially at APHA last year, and within the first week of our launching, we had almost 2,000 hits on our website. So it's definitely something that folks are interested in. Currently, we've got 9 trainings in 3 clusters. So we've got an Introduction to Public Health Law cluster that includes a Public Health Law Past and Present course, a Structure of Government course, as well as a course on preemption in public health. We've got a series of overview trainings in our second cluster on legal epidemiology. So we've got a training on Introduction to Legal Epidemiology, a training on legal mapping, and then a training on advanced legal epidemiology methods. And then we've got a hot topics cluster, which everything that doesn't fit in the intro category or in the legal epi category for now is sort of in our hot topics. And we've got a training there on prescription drug overdose. We've got a training on public health emergency law. And we just recently released a training that's very specific. It's on collaborative practice agreements between pharmacists and providers. And it's worth mentioning that the academy, we want it to be a needs-based training program. So as we hear about the training needs in the field, in the realm of public health law, we're taking that information down so that we can create these competency-based trainings for the Academy that are useful and that satisfy the needs of the folks in the field. So most recently, and on the queue, we have for training to be developed, a training in tribal public health law and federal Indian law. We've heard a need for trainings on administrative law, and we're also looking at developing maybe some updated trainings that are focused on emergency preparedness and also the opioid crisis. And so I guess I'd like to use this time, if anyone's listening in on this podcast, if you have ideas for trainings for the Public Health Law Academy, please send them our way. As we continue to build this academy out, we want it to have what the field says is needed in this area of training.
And so I was looking on the site, and it seems like legal epidemiology is an emerging field, and I haven't seen a lot of information other than the information that I found whenever I was looking you up.
One of the most important things that we're learning about this concept of legal epidemiology, and just to define it for the folks that don't know, we define legal epi as a scientific study and deployment of law as a factor in the cause, distribution, and prevention of disease and injury in a population. Our legal epi trainings are really for public health practitioners. The important thing to note is that this work needs to be done, evaluating and studying the impact that law has on health outcomes. But it can't just be lawyers at the table. It's definitely a transdisciplinary sort of field and opportunity. And so, yes, we are working really hard to ensure that folks that need the in-person training, folks that are doing this sort of work, we're trying to answer their call. But students and people who are new to the field of public health and new to the field of public health law, they are really being drawn to the online legal epi trainings because it provides them an opportunity to learn the language and the lingo and to, if nothing else, begin to identify when a legal epi study may be helpful to the efforts that they're working on in their communities.
And I saw that you have the state, tribal, local, and territorial Public Health Attorney Institute. How does that kind of differ from the public health law program? Within
our program, within the public health law program at CDC, we work in three primary buckets. We have our legal epidemiology bucket, our team that does legal research and translation, and it's run by a woman named Tara Ramanathan. We have our partnerships and outreach branch or arm of our team that really works on partnership and outreach and publishes our CDC Public Health Law News. And that team is run by a woman named Abigail Farrell. And then there's my team, the Training and Workforce Development team. And I think that, when we first developed this training and workforce development concept, it was really focused on training public health practitioners on how to use and understand law as a public health tool. Through the years, we've begun to understand that a lot of lawyers coming into this field that are representing state, tribal, local, and territorial health departments may have taken, if they're lucky, a public health law class in law school. They may have even taken a constitutional law class where they may have been exposed to a lot of the principles that underlie public health legal practice. But we found that a lot of them are not as familiar with theories and principles of public health, and it helps to have a community of people who are practicing public health law in order to make people want to stay in the field, to make people want to build a career in public health law representing state, tribal, local, and territorial health departments. And so what we're calling our STILT Public Health Attorney Institute, or sometimes called the STILT Institute, is a new training initiative that we began to offer last summer. It's a 2.5-day course, but it's designed specifically for attorneys who represent STILT health agencies and who've been in their jobs for 3 years or less. The Institute provides an opportunity for these attorneys to come to CDC, to learn about CDC culture. It's an invitation-only, interactive, boot camp-style type of training, but it really gives these attorneys a chance to understand the mission and vision of CDC, to learn how their skill set can help advance not just the efforts of their agency, but the public health efforts in their community, and gets them kind of on the same sheet of music with regard to the legal foundations for the practice of public health in this country. And it gives them an opportunity to make friends. One of the things that has brought me joy about working in public health is the mentors and the people that I work with who are committed to advancing the health of our country. And I think for lawyers coming into the field of public health law, it's very important to make those connections early on if you want to build a career, to find your mentors, your peer mentors, and the colleagues in your cohort that will really help you as you move forward in your career. And so that's what the Stilt Institute is all about. We started this program, as I mentioned, in 2018. We had our second cohort of students this past summer, and we've just started the planning for next summer's institute, which will take place, we believe, in June of 2019 here at CDC's campus. So we're super excited about it.
As far as internships are concerned, what types of programs do you have available for public health students?
We love students, and we love a wide variety of students, but we do offer academic credit and volunteer internship opportunities for students that are in master's level programs earning public health degrees, public policy degrees. We've had communication students, business students, public administration students. We've got 3 tracks of internships, and we accept students on a rolling basis throughout the year. We've got our administrative and communications track, which is more for our MPH students, our MPA students, communication students, and the like. We've got our public health law internship, which is for students that are earning their law degree. A lot of those students are also JD and PH students more recently. And then we've got a tribal public health law track for students that are specifically interested in learning more about tribal public health law and federal Indian law. Each of our interns each semester are paired with a preceptor, a subject matter expert on our team that serves as a mentor with them, provides hands-on mentorship and training. And we've really done a good job of formalizing our internship program in a way that each of our students walks away being able to check at least 4 core areas of professional development. So there's some legal writing. Whether you're a public health student or a law student, you get exposed to some legal writing. There's writing for public health audiences, and Matthew Penn, our director of the public health law program, he teaches a course for our interns each semester on writing principles. We have our students work on policy analysis and legal epi as well. And so we really tried to provide a true professional development opportunity with our internship here at the Public Health Law Program. I would like to say that October 31st is the deadline for our applications for our spring internship opportunity. So if anybody's listening in, you may want to check that out.
You've given a lot of advice, of course, on this call, but is there any other career advice you might give someone, just someone who's brand new to public health or someone who actually wants to pursue public health law in particular?
There are a couple of things that I typically tell students when they're at the beginning of their careers, but one of the things that I mentioned bloom where you were planted, and I mentioned, think about substance over form. It may not look like what you want it to look like, but I would say don't get boxed into your dream career plan, particularly early in your career. As I mentioned earlier, had I done that, I wouldn't be in the role that I'm in now, which is, I really think I know, a role that was made for me. When I first got to CDC, working with scientists and having to learn public health, I didn't want to publish on lead poisoning. I didn't want to learn the science. I didn't really want to understand, the technical parts of public health that were necessary for me to advance. But it was friends, mentors, connections that helped me understand that this personal skill set that I have, the passions that I have a place in public health. And so I had to not box myself into the vision that I had for myself, but be willing to see other opportunities as exactly that, as opportunities to advance my personal skill set. One of the things that I tell students along with that is you want to be flexible, don't box yourself in, but it's a lot easier for me to provide guidance and advice to students when they can come to me with at least some concrete idea of where they think they want to go. This advice is going to sound contradictory. Pick a thing, plan for that thing, start doing the work, start building your resume toward that thing, and say that to people so that people like me hear that, and I'm like, oh, I've got a new project you may be interested in. Be kind of convicted about that idea of where you think you want to go. But on the other hand, be flexible when you're talking to people who have seen this field from that 10 or 50,000 foot perspective, because there may be a position for you, or a role for you, or a job for you that fits your passion and your skill set that you haven't even thought about. So don't box yourself in, but definitely bloom where you're planted. That doesn't mean stay stuck. right?
Right.
Doesn't mean stay stuck. If an opportunity presents itself and you can check all the right boxes and it sounds like the right opportunity for you, take it. But, sometimes it's best to really hunker down and learn something to prove to other people that you can do that same thing in something else before you jump ship.
And one last thing, we talked about forming connections, and one of the most important things to me is being relatable. People need to see people like them in these roles. People need to know that, hey, I'm just a regular person just like you. But as far as like being relatable, so I follow you on social media, and I'm like, wow, she is out here living her very best life. What are some of your hobbies? I know you like to travel.
I do. I love to travel. I like to run. I try to do at least one charity 5K every month, and I've set a goal to try to run all 50 states at some point in my life. I'm up to 27 of the 50 states. I do a little bit of professional voiceover work, and I also do a little bit of commercial acting. So those are kind of the hobbies that I do on the side. I come from a family of people that have a mantra of, we take the if out of life. If there's something that you have a desire to do, we try to figure out a way to do it. Life is short, and there's the personal life and there's your professional life, and I think that you got to find a way to balance the two. I'm not the best at it. There are often days where I'm working till 1 a.m. in the morning, but I definitely try to completely shut down all of my devices and get out and go for a run on a regular basis. I try to travel with my family as often as I possibly can. I really try to get that balance. And, I don't know that I would be as effective in the job that I have if I didn't have that balance. Because my job requires that I talk to people and be out in front of people. I can't just sit behind a desk. So I've got to be doing those things that kind of keep me energized.
Well, thank you so much, Ms. Ransom, for joining another episode of Public Health Perspectives. And thanks to the CDC as well for allowing you to give me the opportunity to speak with you. Is there anything else that you would like to add for the podcast?
No, I just thank you very much for this opportunity, and I certainly hope that this encourages some folks that are interested in the field of public health or the field of public health to consider careers in public health law.
All episodes of Public Health Perspectives are available on JPHMP Direct, which is the companion site for the Journal of Public Health Management and Practice. Also check out JPHMP Direct Talk, which includes conversations that bridge the gap between research and practice. All podcasts are also featured on SoundCloud, Stitcher, TuneIn Radio, and iTunes. And don't forget to follow us on social media on Facebook, Twitter, or Instagram at JPHMP Direct. For those listeners who are interested in true medical mysteries, check out Backstories in Epidemiology on JPHMP Direct. The most current backstory, entitled It's All in the Bottle, chronicles an apparent outbreak of tuberculosis in a Virginia state prison for women. Read more to learn how Dr. Asim Jani, an officer for the Epidemic Intelligence Service and the Virginia Health Department, fight to curtail this sudden exponential outbreak.